These are the real stories of the ER that doctors never talk about.
Someone help! My son OD, he on drugs, someone help!
What did you take, buddy? We could not assess him because the mom was so frantic.
I'm gonna get your urinal here.
He just fell right on me.
Hey.
We heard this piercing scream. I have absolutely no idea what's going on.
She was confused.
Temperature 88. 88? Are you kidding me?
And I began to think about my father and the slow diagnosis that led to his death.
These are the untold stories of the ER. Life in the ER can go from 0 to 60 in seconds. Just ask Nurse Terry Foster.
You're welcome. I remember I was working in the emergency room. It was a Saturday afternoon. Hey, can you have the doc check the lady in 3 for me?
Yeah, sure thing.
Okay, I appreciate it. And I heard the life squad doors open.
Someone help! My son OD, he on drugs, someone help! Help, someone!
The squad came in with a young boy.
It's
okay, it's okay. It's all right. What's going on?
Please, doctor, he on drugs. He OD, he unconscious.
To take care of him.
His mother found passed out.
Okay, let me check him out.
BP is 120%.
All right, let me check him out.
We could not hardly get any information from this boy or even assess him because the mom was so frantic.
Check him out. I'll check him out, okay?
She was grabbing my shirt. She was yelling and screaming, "My kid's on drugs. He's on drugs. My kid's overdosed. Somebody help him."
Okay, what do you think he took?
Tell nurse what you took.
Okay, what did you take, buddy? Okay, let's get him on 2, all right? Okay.
The older son, he looked like someone who you might think might be on drugs, just his appearance, his makeup.
All right.
Nate, are you on any medication for anything?
No, but his brother had pill. That's probably what he on.
Okay, all right, we'll check that out. Your stomach feels normal. Have you vomited at all?
He fell off toilet right on bathroom floor.
Okay, all right, I understand. I'm gonna check your oxygen level with this clip on your finger, and I'm gonna check your temperature, okay?
He was pale, he was kind of withdrawn, and wasn't answering questions real readily, but I felt like there was something going on with him.
Temperature's okay, Nate, but your heart rate's pretty fast. You really need to tell us if you took anything
heart rate
or what you took. Let me talk to him.
His heart rate was about 130, and that concerned me because there are medications that can make your heart rate go up pretty dramatically.
I'm Dr. Williams. Nate, what seems to be the problem?
He passed out. I think he on drug.
His vitals are normal, his heart rate's elevated, but he doesn't have any pain anywhere.
Shoulder hurts.
His shoulder hurt. What that mean? He had a heart attack.
Nate, can you point to where the pain is?
It just hurts. We need you to fill out some paperwork out front so we can proceed and take care of him.
Okay.
So
I never want to take a mother away from a child, but I certainly needed to get some information. So briefly, I wanted to remove this mother from the situation because she was really heightening the level of anxiety in that room.
Nate, you need to tell us what you took.
The doctor also asked the patient if he had taken anything, and the patient denied it. So that's the only angle we really had to go from.
Now let's get a urine screen and a blood alcohol on him.
Okay, anything else?
Just keep a close eye on him.
Okay.
He could be on some pretty heavy stuff.
Everybody at that point pretty much assumed that it was a drug overdose, including myself. How long ago did he take it? How much? What effects it might have were all things that were going to be of great concern if we couldn't find out what it was that he took.
Dr. Scott Kapoor wasn't sure what area of medicine he wanted to specialize in until his father's untimely death.
Well, my father was visiting India, and he suddenly took ill, and he was taken to the hospital. Unfortunately, he passed away. There was no CPR when he went to the emergency room. There was no emergency ward. The care he received was substandard. Hey, Joan.
Hey. Looks like it's gonna be an easy night.
Oh, no. Shouldn't have said that. I couldn't help my father, but I want to be able to help other families in the same situation, and that's why I became an ER doctor.
Emergency? How far out are you? Okay, thank you. Female, 35, confused low blood sugar.
Okay, let's prep bay 2.
Doc, this is Shannon. Husband called 911, said she was incoherent. BP is 110/65.
Hi, Shannon. I'm Dr. Kapoor. She looked like she was in her 30s. She looked very fit and tanned, and she actually looked well, but she was confused. Is the husband here?
No, he's looking for a babysitter for their infant.
Where am I?
You're in the hospital, Shannon. Let's take over to bay 2.
Her sugar levels were low, so we gave her a glucose gel.
Usually when you see a confused person, they're drifting in and out of consciousness. She was not drifting in and out of consciousness. In fact, she was awake and alert. Shannon, not if you can understand me.
Where am I?
Shannon, do you know what year it is?
Why am I all by myself?
Shelley, let's do a drug screen. The initial reaction that I had was, is this real? Hey, guys, just hold on a sec. I have a few questions. Somebody potentially has taken some overdose of drugs. Do you know if she's taken any drugs?
We asked the husband. Says she's not on any meds and she doesn't even drink. She just had a baby 3 months ago.
Anything else?
Well, he said earlier today she was having trouble hearing. Now, he was concerned. He just checked her over and he said that her pupils were dilated.
And you gave her some glucose, did you?
Yeah, 1 amp of D50W.
Okay, thanks. We'll take it from here.
All right, see ya.
So her dilated pupils could be just due to the effect of the low glucose, or it could just be a response that her body was trying to fight something. Shelley, let's hold off on that drug test. I want to add some more labs. Can we add a CBC, Chem7, a glucose, and I want you to culture all up.
But I had lunch yesterday.
It's okay, Shannon. James, do you have her vitals?
Yeah. Blood pressure is 126/67, heart rate 126, and the temperature 88.
88? Are you kidding me? When I touched her, and I saw that she was cold, it became just more confusing. What was that blood pressure again?
126/67.
When your body temperature goes down, we would expect that we might even find also a low blood pressure. But in fact, her blood pressure was not low, it was normal. I was actually thinking, I don't know what's going on. This makes no sense.
No! 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 No!
Andy, this is the last part, and then we're going to be all done.
In the ER, staying calm in the face of turmoil is no easy feat.
Just a quick little pinch, and we're going to be all done. Here we go. 1, 2, 3. Andy, you did a really great job. Here, let me get you something.
Dr. Kip Adrian has built a career on his ability to remain calm while patients panicked.
Oh, nice arm. Take care. You were really brave, man. I tend to stay pretty cool no matter what the circumstance. Things that would typically rile other people up, at least on the outside, I don't really let it show.
So, how do you do it?
Do what?
Stay so calm and collected.
You know me. Although I may be extremely nervous internally, it's something where there's a projected cool that I think permeates.
Okay, Dr. Cool. We've got a new case coming in that's right up your alley.
What is it? We heard this unbelievably piercing scream. Hey guys, what's going on?
He woke up screaming. Heart rate's high. Other than that, he seems fine.
The paramedics brought in a gentleman who appeared to be very, very healthy without any other medical conditions that you could discern from just looking at him.
He's completely unresponsive, almost catatonic, except for that.
How often is he doing that?
About once a minute or so.
All right, who made the call?
His wife placed the 911 call.
All right. Sir, it's Dr. Adrian. Sir, can you hear me? Sir, can you hear me? Wake up. Jeez, let's get him down to trauma 1. Again, this blood-curdling scream pierced the air. People that were carrying stuff dropped it. People that were standing kind of jumped. It drew everybody's attention very quickly to the point where patients in other rooms were suggesting that we go check on that particular patient.
His name is Eric.
And has anything like this ever happened to him before?
He just woke up screaming in the middle of the night.
So no ideas what might have triggered this?
No, I asked him what was wrong and he wouldn't answer me. He won't talk to me, doctor, and this is not like him.
He just woke up screaming in the middle of the night. Eric, can you hear me? Eric, if you can hear me, I want you to close. Eric, if you can hear me, I want you to close. He wasn't moving, he was laying perfectly still, except that he just wouldn't voluntarily move, he wouldn't voluntarily follow directions. Eric, if you can hear me, I want you to try to close your eyes. I would have thought that would have done it again.
What's going on here?
I don't know. I've never seen anything like this before.
Dr. Kapoor, her blood pressure just shot up.
When her blood pressure spiked, we knew we were dealing with something that just didn't follow a typical pattern at all.
Doctor, what's happening?
She's freezing all over. James, can you get the warmer?
You got it, Doc.
Dr. Scott Kapoor can't figure out why his patient's temperature is 88 degrees, 10 degrees below normal.
And Shelley, can we get some warm IV fluids? I want to warm her up.
Right.
We considered hypothermia, of course. I mean, has she been out in the cold? Has she been out skiing? Shannon, nod if you can understand me. Have you been outside? We tried to warm her. So we put a bear hugger on her, and we gave her warm fluids.
Where's Tom? Dr. Kapoor, her blood pressure's dropping.
But at that point, she got even worse. Could be an infection progressing through her blood. Let's treat her for that. I don't want her to go into shock. A shock state means that their blood pressure goes down, and if their blood pressure goes down, there's less blood flow to the brain. And so when there's less blood flow to the brain, therefore they become more confused.
Are we finished?
James, can you get me 1 gram of cephalotaxime? We treated her with a wide-spectrum antibiotic, which would kill most of the life-threatening bugs that could be in her blood.
She hasn't been skiing. She's been sunbathing. Look how dark she is.
Shannon, have you been outside in the sun at all?
Maybe that's her normal skin color.
Where's her husband? Can somebody find him for me and bring him here?
I'm on it.
The nursing staff are kind of looking to you to solve the problem. And you're actually alone. You're the only physician in the department.
So we just monitor until something changes?
At this point, I'm looking at any possibility. She has the strangest combination of symptoms, and it's giving me mounting concern as her symptoms accelerate. But she's still incoherent, she's confused, blood pressure's going down, and she's freezing cold. It's just not adding up. At this point, I suspected something life-threatening, and I began to think about my father and the slow diagnosis that led to his death. And I certainly didn't want to be the doctor who missed this diagnosis.
So, what do you think?
Let's try to rule out something neurological. Let's rule out a stroke, a tumor, or a bleed. Let's get a CAT scan.
Okay.
One consideration we had was that could she be having a stroke or a bleed or a tumor in her brain that progressed to the point where she became confused. This patient had just had a baby, and to lose her would be a double tragedy.
Emergency nurse Terry Foster needs to find out what drug his patient is on.
Hey, Nate, I'm going to put this up.
We were going to have to get a urine drug screen, so I took a urinal.
I'm going to need you to pee in this for me, okay?
Yeah.
Okay. I'll give it to you right here, and I'll step out and give you some privacy, okay?
Doctor suggested see if I could get some more information from the mom, but maybe keep her in the lobby just for a little bit because she was so anxious at the time. So we put her in a room we kind of call the bad news room, which provides a lot of privacy for when we have to talk to a patient or their family.
Sam, 你講俾我聽啦，Sam，唔該你啊，講俾媽咪聽啊。
What if I told you you won't believe me? What's the point?
我會信你㗎，你講俾我聽，幫下你個細佬啦。
I need some more information from you before we can treat your son completely. What makes you think he overdosed?
A few weeks ago, Sam OD. I found him on the floor just like Nate was today. They look the same, pale and sweaty.
What exactly happened today when you found Nate?
Nate went to store with some friend. And then he came home.
All she knew was that he had gone to the store with some boys. She doesn't like some of these boys, and she thought the boys gave him some drugs or that his older brother gave him some drugs.
I heard Sam yell for me, and I run downstairs. I see Nate on floor. He looked dead. Now it happened to me 2 times.
Unfortunately, this lady had had an experience before where her older son OD'd, kind of similar circumstances, and that's exactly why she thought this is what happened to her younger son as well. So we really wanted to get the urine drug screen. We wanted to know exactly what he took, and then we would know exactly how to treat that.
Nate, you didn't pee for me.
He was still laying there on the stretcher holding the can, and he looked down at it like he didn't even know he was holding it.
Dr. Kip Adrian's patient won't stop screaming. And it's having an effect on the ER floor.
When the patient would scream, it really did have quite an effect on everybody in the department. People would drop charts. People would jump up out of their chair every time he did it. I would jump, the nurse would jump, his wife would jump. The only person that really wasn't affected by it was the patient himself.
Reading looks normal.
Why is he doing this?
Lynn, I'm not quite sure. When we examined his pupils, they were reactive, but he wouldn't follow any objects with any eye movements. He looks to be in relatively good shape. As we went through the rest of the exam, everything seemed to be remarkably normal. Except for that. The screams were like a 12-year-old girl having her arm torn off. Is there anything else that you can tell me about him? Any alcohol or drugs? She said no, he wasn't that type of guy. He was very fit, very active, very healthy person. Any new trauma, any history of seizures or neurologic conditions?
No, he's generally perfectly stable. Generally.
She was remarkably cool, given the whole situation, but really she had nothing to lend that would help us at all. If I said that maybe my reputation was for being fairly relaxed, this person got under my skin pretty quickly, in that you just didn't know when the next one was going to come. I'm so sorry. And even though you knew it was going to come, still people were extremely exacerbated by the noise.
I need helping too.
He had no blood pressure.
This boy's crashing. Let's get the BP back up.
He looked like he was dead.
Dr. Scott Kapoor's patient is incommunicative and ice cold, but alert. It's a very puzzling set of symptoms, and it's making him nervous.
We really had a very confusing picture. When somebody is altered, we think initially probably infection, we think maybe a head bleed, a stroke, a tumor. We did a CAT scan of her brain, and it didn't show anything.
Dr. Kapoor, the husband will get here as soon as he can. Still looking for a babysitter.
All right, so she's incoherent, she's confused, her blood pressure is not stable, there's no obvious infection, brain scan's normal. What about meningitis?
You think?
Yeah. Let's do a spinal tap. And meningitis is an inflammation of the meninges, and it can actually cause an infection in the spinal fluid. So if you miss meningitis, a person will die. Okay, Shannon, just try to keep very still. Okay, Shannon, you're just going to feel a sharp poke in your back and then a little burning, and then it'll be all good after this. All right, here we go. A spinal tap, otherwise called a lumbar puncture, is a routine part of the practice of an emergency physician. Okay, now, Shannon, you're just going to feel a little bit of pressure. Of course, there are concerns because of the fact that you are actually introducing communication with cerebrospinal fluid that goes to the brain, and so you don't want to introduce an infection into that area. Okay, so here we go, a little bit of pressure. Very still, Shannon. You're doing great.
Doctor,
Mr. Chaffee's here, Shannon says me.
Okay, thank you very much. Nurse, can we put some pressure on her back? Just clean her up?
Wow, what's going on?
We don't have a firm diagnosis as yet. We're just running some tests.
Do you mind if I just spend a moment with her for a second?
Oh, yeah, no problem. I'll just be at the nursing station, okay?
Thanks. Sweetie, I'm here. I'm here.
It was probably the scariest moment in my life. And it was frustrating not to have the medical community at the hospital tell me in short order that this is what's wrong with your wife and she's going to be fine. They weren't able to say those kinds of things because they didn't know what was happening.
Oh, thanks, Mr. Chaffee. Tom, your wife is presenting with so many different symptoms. I'm just trying to explore different possibilities. I have a question. Have you been away on vacation by any chance?
No, we haven't been away since the baby was born.
Well, I just noticed that she's very tanned.
Dr. Kapoor asked about her tan, as most people do. He thought, you know, we'd just come from a nice tropical vacation. And I told him, like I told everybody else, no, she's always been tanned ever since she was a young child.
No, she's brought up in an Irish family. Everyone's snowy white except for her. She's always had a tan.
Dr. Kapoor, the lab results are back from the spinal tap.
They're normal. So the spinal tap was normal and I could rule out meningitis, which was a bit of a relief, but I still don't know what's wrong with her, so I'm back at square one again.
Dr. Kapoor, her blood pressure just shot up. 240 over 150.
When her blood pressure spiked, we knew we were dealing with something that just didn't follow a typical pattern at all.
Doctor, what's happening?
We're still trying to piece it together. I'm just going to investigate what's going on. Unfortunately, we had nothing to tell him because we weren't sure ourselves what was going on.
The hand was available through the warming blanket, so I held that, but she was basically unaware that I was there.
Shannon, you're in the hospital. We have a 3-month-old baby. You understand?
In some respects, she was very childlike at that moment, and that's the way we spoke to her, as if she was a small child, and tried to get her to understand her situation, but that was difficult. I was tired, Dr. Kapoor was tired, and it was probably 5 or 6 o'clock in the morning, and there were still no answers or no indications about what was happening with Shannon.
After hours of testing, Dr. Kapoor gets his first big break.
Emergency. Yes. Hey, Doc, guess what her sodium level's at? 107.
Sodium of 107?
107 is dangerously low. Normal sodium level is between 145 and 155.
If you let that sodium stay low, it could cause her brain to swell, and it could lead her to go into seizures, and it could lead to respiratory arrest. So we had to correct that. On the other hand, if we corrected it, and we corrected it too fast, believe it or not, that can actually kill you. Okay, Shelley, we've got to increase her sodium levels. It can lead to an irreversible condition, whereby you cannot move your arms or your legs, you can't speak, you can't swallow. So it's a very devastating consequence. So we're going to keep her at 0.9% normal saline and increase her rate to 300 cc's an hour. When you're in the middle of a medical mystery, you don't know whether it's the first thing you do or the 20th thing you do that will save a patient. Or, in fact, kill her.
Nate, you didn't pee.
Nurse Terry Foster is still trying to figure out what's wrong with his patient. Everyone suspects he's overdosed on drugs.
Nate, I need to talk to you. You will not get in any trouble, but you need to tell me what you took so we can take care of you.
Mister, I'm not on drugs. I swear, I don't know what's happening.
At that moment, it just struck me how this kid looked at me and said it, and he was respectful. He said, "Mister," and he had direct eye contact with me, and it just made me right away feel like that he was telling me the truth.
Okay, I believe what you're telling me, but we still need a urine sample. I need you to go. Will you go for me?
I really believed that there was something else going on by the way he said that to me with such drama.
Something's wrong with that kid. I don't think he's on drugs. I think it's something else.
She looked at me like I was an idiot, and I said, he just looked at me and said, I didn't take anything, and it was kind of dramatic how he said it. And she was like, oh, for God's sakes, how long have you worked here?
Oh, by the way, I have some swampland in Florida. I know you love it.
Yeah, right.
It just, things didn't add up.
Nate, you still didn't pee for me. I'm gonna sit you up here. I need you to pee in this can, okay?
I sat him up on the side of the stretcher, and I reached down to get the urinal, which I had sat down to help sit him up.
And I'm gonna get your urinal here. Hey.
He just fell right on me.
Nate.
It startled me because he just fell. His face was like right on the side of my neck.
I need helping too. Nate.
I could not feel any kind of peripheral pulse. He had real shallow, almost absent breathing.
Teresa, bag him.
He wasn't moving, and he had no blood pressure.
This boy's crashing. Let's get the BP back up.
He looked like he was dead.
That's weird.
What is it?
You stay here with them. I'll be right back. You've got to come and look at this.
I'm so sorry.
Dr. Kip Adrian is still baffled by the cause of his seemingly healthy patient's incessant screaming.
So I'm not really sure what's going on. The tests don't really point to anything. His exam really doesn't make a lot of sense. I don't know what's going on.
Sounds like a psych case.
Yeah, it could very well be. I'm gonna go and try and make him talk. Hey. Eric. Eric, how you feeling, buddy?
I don't think he hears you, Doctor.
Eric, we want to help you, but you have to tell us what's happening here. Is there something bothering you?
The difference between us and veterinarians is that our patients can usually help us along a little bit as to what's going on. And this guy, it was like veterinary medicine in that he could give us nothing, could not communicate whatsoever what was going on.
Eric.
For such a young man to not be able to cooperate in some way in terms of communicating what was going on was unusual and really, really frustrating.
All right, I'll be right back. Carrie, we need to bring him down a notch. Let's give him haloperidol, 5 milligrams IM, draw Rainbow Labs, and order CT scan of the head.
Okay.
All right, thanks.
We were formulating a plan based on the idea that this was something psychiatric or neurologic.
It's all right, Eric.
We're about to start in on a fairly large workup to figure out what was going on.
We're gonna help you through this.
The nurse got down the level of the patient and noticed something.
That's weird.
What is it?
You stay here with them. I'll be right back. You've got to come and look at this. Come on. Take a look at his ear.
I looked in the patient's ear and I saw something that I will just never forget.
Oh, man. I need helping too.
Nurse Terry Foster's patient is in critical condition.
Teresa, bag him.
The attending physician thinks he's overdosing.
This boy's crashing.
But Terry is not convinced.
Nate, what's going on?
They need to know for sure, and fast.
Events move very quickly, but they seem to move very slowly at the same time. And I just couldn't believe that I had a 13-year-old boy in front of me who was dying.
I got 2 16s in him going wide open.
We got 2 large bore IVs in him to give him fluids.
Let's beat these back up. Nate?
And we got him back really pretty quick. Within a minute, he started kind of moving, groaning.
What's going on?
Son, you gotta tell me what's wrong, what you took. Nate, if you don't tell us, you're gonna die. I'm sorry to scare you, son, but this is really important. You need to tell us.
He was right in his face and he said, "You're gonna die if you don't tell me." And he was like, I didn't take anything, I didn't. And I said to the doctor, I said, "I'm telling you, I don't think he took anything."
Nate, when you were with those boys, did they give you anything to take? Did you eat anything you don't normally eat?
What did you do this morning when you got up? What did you eat? Where did you go? What did you do? Kind of going through the events of that day.
How did you get there? Did you walk? Did you drive? Did you ride a bike? You did?
Hey, more pressure on the fluids. Come on, Nate.
Hey, Nate, did anything happen when you were on the bike? What?
Went over my front. Hit the handlebars.
Hit the handlebars. Is your stomach hurt?
He said that the handlebar went right into my abdomen.
Oh, wow. That wasn't there before.
Spleen.
We knew instantly that he had a ruptured spleen, and we had to get this kid to surgery right away.
Shani, can you hear me? Do you understand me?
Dr. Scott Kapoor has a patient with puzzling symptoms that resist diagnosis.
You have to increase her sodium levels, but we're going to do it very slowly.
He is about to apply a treatment that, if administered too quickly, could kill her.
When we had the low sodium, I had an idea of what we were dealing with.
Well, Doc, there's no change in the sodium. It's still low.
Take a look at this. The potassium's pretty high.
Low sodium and high potassium. I wonder.
What are you thinking?
Well, it's something I came across when I was trying to figure out how my father died. My father passed away suddenly in India. He happened to be on steroids for a medical condition, and I was researching what are the possible things that could have killed him. And I came across a condition known as an adrenal crisis. An adrenal crisis, when your sodium is low and your potassium is high, that this could be an adrenal crisis. In other words, your adrenal glands could be shutting down completely. To confirm the diagnosis, we'd need to get a cortisol level, but that could take 24 to 48 hours. We don't have that kind of time.
Well, what's the treatment?
The treatment's hydrocortisone. Let's do it. Let's give her 100 milligrams of hydrocortisone. We didn't wait for the cortisol test because it would take days to come back. And we were worried that if we did nothing, she would just simply die. Okay, let's do it now. 100 milligrams of hydrocortisone IV push. I thought I had the right drug for the condition, but I had no test to back it up.
100 milligrams hydrocortisone. Given.
Take a look at his ear.
This was essentially this man's worst nightmare come true.
Take a look at his ear.
What's going on?
Dr. Kip Adrian may have just spotted the cause of his patient's maniacal screaming.
There was quite a large bug, large enough that you could see the very end of it sticking out of the ear canal.
Oh, man. Hey, can you grab the otoscope for me? Oh, my gosh. That's a roach, it looks like.
The patient had a bug in his ear that was pinching or biting into his eardrum, and every time it did, he would let out this scream that sounded like he was dying.
Hey, buddy, I think we found the problem. There's a bug in your ear here. We're gonna try to get it out. I think you're gonna feel a heck of a lot better. All right, Eric, I'm gonna turn your head to the side just a little bit here. All right, put in a little medicine.
What we did was we put some lidocaine in his ear to suffocate the bug and also to numb the eardrum.
All right, good.
Hoping to take away some of the pain.
All right, that's slowing it down. All right, great. You got the forceps. Okay, Eric, here we go.
We used some small forceps to try to extract the bug, hoping that it would come out in one piece.
Shoot. Well, every little bit counts, I guess.
Unfortunately, it was a big enough bug, or it had latched on again, that as we pulled it out, it was coming out in small pieces.
Let's see if we can get the rest.
And so we were getting chunks of the body, and then its innards were spilling around a little bit into the viscous lidocaine.
Can you get the suction for me, please? Thanks. All right, just a little bit more, Eric.
Ultimately, we used a small suction device to finally remove all the particles from the ear canal. It took some doing, but it eventually came out.
There we go. All right. I think we got it. Oh, well, not the best looking critter.
It was nice to be able to tell the wife what it was, because she was obviously greatly relieved.
That little thing caused all that screaming?
Yeah, well, the pincers on the eardrum, I can't imagine the pain he's feeling.
Yeah. Eric? Hey, hon. Can you hear me?
Almost immediately after removing the bug, the patient snapped to.
Hey.
He was alert, he was talking to us, he was moving everything. He quickly filled us in on the fact that he actually had a long-standing phobia of bugs going into his body. He was absolutely deathly afraid of it. So this was essentially this man's worst nightmare come true.
When I woke up and felt the pain, I knew something was in my ear.
Why didn't you tell us? You know what it was when we didn't.
I panicked. Everything closed in on me.
Okay.
Realizing that his worst phobia had come true, that he was literally paralyzed with fear.
All right, guys. I'm writing out some instructions for you on how to take care of yourself for the next 24 hours. I'm glad you're feeling better. Take care.
Can't thank you enough, Doc.
You're welcome.
Thank you so much.
Nice to meet you.
Okay. That's a good boy.
Oh, I get one too. Thank you.
Welcome. Take care, you guys.
Thanks a lot.
Thank you.
This is one of those classic examples of things that sometimes seem really complicated. There are oftentimes some really simple answers, and to keep that in mind when we're addressing tough issues.
Home to sleep?
It's about that time. I'll see you later.
Somehow I managed to keep my reputation for playing it cool, but I must admit that for the first few nights after the case, I did think about it quite a bit, and especially when I was falling asleep.
Is your stomach hurt?
Nurse Terry Foster and his team finally figured out what is wrong with his young patient. It's not a drug overdose. It's a traumatically ruptured spleen.
The spleen's a very vascular organ, and at any one time it can sequester like about 1,000 cc's of blood.
Yeah, the abdomen is distended. We need an abdominal x-ray. We gotta call the OR right now.
I'm on it. X-ray will be right over here, and I'll notify OR.
Oh, can you tell the mom about the situation? She needs to see him before he goes up.
Okay, sure will.
You're gonna be okay, Nate.
I felt like at least we knew what it was. We knew how to treat it. It looks like Nate has a ruptured spleen. We're getting an X-ray right now to confirm it, okay?
Not drug.
It's not drugs. He did not take any drugs at all that we can tell. Spleen injuries are difficult to diagnose. They can often be hidden. They can be a delayed rupture, and sometimes people don't have very obvious symptoms until they actually have a lot of blood in their abdomen. So I was very worried about that would he bleed to death before we got him to surgery.
Sam, I'm sorry. I so worry about you too. Do you forgive me?
Yeah, yes.
Okay, we're gonna have to go back and see him now because he's gonna go up to surgery, okay? I'll take you back there, all right? Okay, just follow me.
Tom.
Shannon. Oh, babe, you're not gonna believe this.
Dr. Scott Kapoor has diagnosed an adrenal crisis in Shannon.
Okay, let's do it now.
And has administered hydrocortisone.
100 milligrams hydrocortisone given.
Hydrocortisone is a steroid that is normally produced by your adrenal glands, and when your adrenal glands are not functioning, it simply replaces that. We had tried raising her glucose levels, doing a spinal tap for meningitis, raising her temperature, and raising her sodium levels, all to no avail.
Tom.
Shannon.
But the answer is always in the last place you look.
You can talk.
What happened?
Oh, babe, you're not going to believe this.
I want to be a physician who uses the knowledge of emergency medicine to save lives. And so I wanted to get it right. And so, without knowing the name of her disease, we found the right treatment.
It's good to know that all these symptoms gathered together actually have a name, that it is called Addison's. And it's funny, if I see now someone who I think has the symptoms, I kind of think, I wonder if they have Addison's, and they don't know.
Addison's is caused by unproductive adrenal glands. It can cause fatigue, muscle weakness, and an increase in skin pigmentation that looks like a suntan.
Shannon, good to see you.
I'm thankful that Dr. Kapoor had enough sense in his training to help me to keep me alive, because apparently, according to the doctor, I could have died that night.
I wanted to thank you. Thank you for saving my life.
When you're in emergency medicine and you're doing this day in and day out, you never really think of it that way. You think of it as a job. But she said, thank you for saving my life, and it meant a lot to me.
Not just for me.
It made me feel that I can make a difference.
Thank you, doctor.
And that I can save people like my father should have been saved.
Hi, how's our patient?
Nurse Terry Foster's young patient is recovering from emergency spleen surgery.
I heard they had to take your whole spleen out.
Yeah.
Nate, thank Terry. Take care of you.
Were you my doctor?
No, I'm a nurse. Do you not remember me?
No.
That's okay. No problem. Glad to see you're doing well. He had no recollection of seeing me, talking to me, or anything. You know you can live a full life without your spleen, right?
Yeah, just flu shots.
That's right.
20 years ago, if you lost your spleen, your life was shortened.
Okay, see you later. And Sam, you take good care of him, okay? Okay, bye-bye.
Now, you can live long and healthy.
The surgeon came down through the ER to tell us how he did, and he said, it looks like somebody threw his spleen in a blender. It was all in pieces. How he survived this, I don't know. Hey, what's going on?
Guess you're right about that kid.
What can I say? I was very happy that I followed my intuition. There's kind of a fine balance there, but I've learned to, when that gut instinct is just kind of gnawing at you and you know there's something not right, I've got a bad feeling that something's going on, to go with that feeling.
Guess I'm gonna sell that swampland to someone else.
Guess so.